So this workshop is just about use of the prompt flex mannequin for demonstrating and learning deeply impacted fetal head during caesarean section. So essentially the mannequin is your standard prompt flex mannequin but with additional modules. So it's got the caesarean section skin with a preformed incision, and underneath we've got the baby deep low in the pelvis simulating impacted fetal head, and this strap is used to push baby even lower and tighten it up. And one of the things that we found is, particularly for the more junior trainees, it can be quite useful learning this with the skin off, so they can actually visualise exactly what's happening, what they're doing, and particularly for learning things like reverse breech extraction, they can see what they're doing. But I think it's pretty good to see it with the skin on, so I thought I'd just demonstrate it first. Obviously, this is not where you would be standing to do your caesarean delivery, so I apologise. But first of all, it's always good to have a little bit of lubrication, and then it's really difficult to deliver the head. So at a push, I could probably just about flex and disimpact it, but I'm going to ask Mary to do a push-up from below. Go for it, Mary. Okay, and I can feel that releases that kind of vacuum that you get, and then that allows me to deliver a head. Thanks, there we go. Okay, and then people can practice delivering the rest of the head. Do you mind putting it in again, Absolutely. Nick, so we can do reverse breech? So it's a good opportunity for obstetricians to learn the technique, but also for multi-professional training, because a lot of the time it might be a midwife, say in theatre, who's asked to do a push-up from below, who's never done it before, doesn't know the position of the baby, doesn't know how to do it, and is feeling a bit intimidated in a high-pressure situation to say, I don't know what to do. And so may just put one finger in, put two fingers in, and push up. And that's where we're going to increase our risk of skull fractures. So it's actually really good to do as a multi-professional training exercise with the midwives as well, and then they can learn about exactly what to do. So say that's failed, or we want to try reverse breech extraction first. It's also really great for trying that. So I can feel I've got a hand there, so I don't want to get that. And then, there we go, I've got a foot. And it's slippy, it's quite realistic, simulating it. So there we go. So I can practice the rest of my delivery. There we go. Again, hopefully when you're practicing it, you're not doing it from behind the baby like I am now. There we go, great. So there we go. So you can practice the manoeuvres really nicely, and also with the skin off. I'll give you that, Nick, and just come over here. So I think if you're concentrating on one thing, like deeply impacted fetal head, it's good to keep it simple and just use this skin. But particularly for more junior trainees, if you want to teach the whole caesarean section from knife to skin to closing as well, there are these caesarean section skin modules. So you put that in instead of the skin, and you can just use a normal scalpel to cut through, and it's got the layers. So you've got the skin, cutaneous fat, sheath, rectus muscles, the peritoneum. In here we've got the bladder, the uterus, and then the membranes. So trainees can have an opportunity to practice. It does feel quite realistic. And then Nick, you were saying earlier about how there's this extra insert that we can put inside that simulates, say, 4 centimetre caesarean section where the head is a little bit higher, so that trainees can just focus on the basics of practicing, okay, standard caesarean section, just delivering the head, okay? And then obviously you can practice suturing as well.